Welcome back. It's now time to go in depth. As the clock ticks towards Jamaica's ban on smoking in public places, there are many questions about the ban. The regulations still haven't been published, so some are calling for more clarity. Here's our look in depth.
With the approval of Cabinet, I have executed the Public Health Tobacco Control Regulations 2013. Mr. Speaker, come July 15, 2013, no longer will our workers and children have to involuntarily inhale tobacco smoke with its over 40 cancer-causing agents. Smoking will be banned in public places. No smoking sign like this, Mr. Speaker, will be posted.
Minister of Health Dr. Fenton Ferguson making the announcement in Parliament on June 25. Those who disobey the ban can be fined $50,000. That's $500 for the first offense. It will affect both smokers and business places that cater to smokers, such as bars, restaurants, and of course, tobacco company Carreras.
The company is on record for many years, at least since 2011, calling for legislation on tobacco control. So we're not surprised that the minister announced it yesterday. We appreciate that he has announced the regulations, and although we haven't seen the actual stipulations, what we gather is that the regulations will make some accommodations for adult smokers in terms of outlet owners being able to prescribe smoking and non-smoking areas.
But according to the Ministry of Health's legal officer, Attorney Cheryl Dennis, businesses will not be allowed to create smoking areas.
That won't be allowed because the purpose of the regulation is to protect non-smokers. It's also to protect workers. And apart from non-smokers and workers, we're talking about protection for children. Now, although the regulations don't address children in particular because that is covered under the Child Care and Protection Act, when we think about a bar workers, somebody works in a bar, so even where you have a designated smoking area, somebody will have to clean that particular area. Smoking is prohibited in public places, and for the purposes of the regulations, a public place is any structure, facility or enclosed space for use or that is accessible by the public. The regulations also speaks of a public place being an area of assembly or collective use. Now, I know I've mentioned enclosed space. When we speak of enclosed space, we're talking about any area that is enclosed by a wall or a roof. So we're not just talking about 4 walls, we're speaking about even 1 wall. So if it is covered by 1 wall or more, then that would be well, for the purposes of the regulations, that is considered an enclosed space. One wall, one roof, yes, because we're thinking about the emissions from the smoke, and once you have any of these, even 1 wall, then you can have an area that is so concentrated that it can affect a third party.
But those answers aren't flying for media personality Simon Crossgill, who's also a heavy smoker, going through a pack and a half a day.
Well, first of all, I have a little difficulty understanding the definition for public places. That's one. The beach is a public place. Lots of air breeze. I can't smoke on the beach. I don't understand why there isn't, as part of that legislation, a definition that allows a business to have a smoking area. Now, the argument put forward by a Ministry of Health person that I spoke to was that there are staff there, and the smoking will impact them. But if you're going to bring in this legislation, that's fine. I understand an enclosed area. I understand that apart from the health issue, it's disturbing to other people around you, so I don't have a difficulty with that. But you are now redefining outside space and what is a public space, and I'm not sure what it is. And try and remember, this is a legal habit. So you are infringing on my rights. If you make it illegal, fine, different argument. But if you carry on the hypocrisy of earning billions of dollars of taxes from the cigarette companies and then try to infringe on my human rights, then I have an issue.
Out on the streets of Kingston, we found mixed reactions to the ban, mostly split between smokers and non-smokers.
Them implement enough law, them implement enough better law for Jamaica, because them a tell you a bag of thing about up to 500,000, up to 50,000. A joke the government are going with. Look how much people hungry, look how much people up on the street, them a talk about public health and rape. Enough things are going. Me no business with them now.
I think it's a good thing because a lot of us don't like the smoke. Some of us have sinus problems that it affects, so it's a good thing.
Does it bother you when people smoke around you?
No, my mother was a smoker, but I mean, because of the health hazard, I think it's a good thing.
Do you think it affected her health?
Yes, it did. She had cancer.
I think it should ban in public places because and everybody smoke, and more time who smoke blow it in people's face, and you know, sometimes you when you smoke it's more dangerous than even man will smoke. You know, and cigarette is the worst thing. Maybe if it was, you know, marijuana is even more vehicle more better, you know. But cigarette or tobacco, very dangerous.
I feel that is good because you have younger kids who are having asthma real bad, and now persons are having cancer so frequent now, so I feel the ban is very good. It's a good thing to do.
Do you know people who smoke?
Yes, I do.
How does it affect them or you when you're around them?
Normally when they smoke, I blow short because I have shorter breath also, asthma, so it's really good. I feel they should do it because I want them to stop smoking too.
Do you think they should ban smoking completely or just in public?
Completely, because it's killing a lot of persons.
I think they should ban it long time ago, because you have people who doesn't smoke and people who smoke. They don't respect the one that doesn't smoke. They just smoke in public places and the street bus. They don't seem to like hold up their head and blow the smoke. They just blow it in your face, all over in your face. Sometimes you have bad sinus or whatever, and then when them do that, it trouble you a lot, make you cough, and so I think they should ban it long time ago.
Well, it's not a bad thing, you know, because you know smoke is dangerous to health, you know, so less people can inhale it and all of that, it's much better for the society, you know. Really with them longevity, because smoking is really good, you know, just a bad habit still.
So you don't think it's unfair that they're telling you where you can and can't smoke?
Well, no, because the government control the society, you know, so they are the one that have the authority to implement them things, you know. So I don't really find a problem with it, you know.
Do you think they should ban it completely or just in public places?
No, I think just in public places is okay because for persons who have a lot on their mind, they find smoking as a way to relieve their stress. Although it may not be healthy, but it's better than having a higher suicide rate or death or crime rate.
So many of those we polled support the ban, including some smokers. Chief Medical Officer at the Ministry of Health, Dr. Michael Coombs, says smoking is a serious public health issue.
The evidence has grown over the past several decades about the harmful effect of smoking tobacco in so many ways, not just on persons, the health of persons who actually smoke, but on those who are in their vicinity and who actually experience the smoke that is involved when they partake of tobacco use, the so-called secondhand smoke. So obviously, when one considers the fact that the leading cause of preventable death globally is tobacco, then the question that we have to ask ourselves, is there a moral responsibility or obligation of any government to protect its citizens, especially when we consider the number of deaths, as I said, which are preventable caused by tobacco?
But Crossgill, who's been smoking for 42 years, says he's well aware of the risks, but a ban on smoking in public won't deter him.
But you do feel the effects. Here's the effect. Sometimes you wake up in the morning, your chest is tight, you're kind of wheezy. I've had asthma, bronchitis and pneumonia, and so that didn't help. But it's that kind of feeling rather than, oh, I can't run the 100 meters anymore. It's just that sometimes you get up in the morning and you feel horrible because you've been smoking a lot. And then you try and cut back a little, but it never really works out like that. But in terms of general well-being and so on, It's not something you consider, especially if you've been smoking so long. The signage you see on packs that cigarettes kill and cigarettes, ruin your lungs and so on. That's generally for somebody who is thinking about starting. Hopefully that would be a deterrent. But for somebody like me, we know all those things and we still do it. I hate any authority. So I don't like anything where anybody tells me what I can and cannot do. But for my own well-being, I'd love to be able to give it up, and I'm going to try. I'm going to try some patches and whatnot. So I'm going to try and give it up, but not because anybody says it's unhealthy or you shouldn't do it here or you shouldn't do any of those things. Purely on a personal level.
However, the ministry is standing firm. The decision has been made and the ban will become effective July 15. If international trends hold true for Jamaica, it could be just the first step towards even more sweeping anti-smoking legislation. And that's it for In-Depth and also for our newscast this evening. I'm Kalila Enriquez on behalf of the entire production team. Pleasant viewing.